More than 12% of Texans are diagnosed with some form of diabetes. That's according to the American Diabetes Association. Treating the disease is getting expensive, and this creates more challenges for those without insurance. GMIT's Andrea Valdez met with an East Texas clinic on their efforts to decrease those numbers in an affordable way. Andrea, good morning.
Well, Victoria, in Texas, one vial of insulin can cost nearly $25 each, and depending on how much is needed for the treatment, that cost goes up significantly. However, one East Texas clinic is working to make sure that those who need it don't go a day without it.
You know, you constantly had to watch what you were eating and not have as many sweets at the sleepovers.
From a young age, Hannah Clark depended on her insulin pump to manage her type 1 diabetes symptoms. Now, as a mother of two, she has a reason to keep maintaining her health.
Diabetes is a very, very hard disease to live with. The complications from diabetes are more devastating than the diabetes itself.
According to the American Diabetes Association, more than 177,000 Texans are diagnosed with diabetes every year. Meantime, 16% of Texans like Clark are uninsured to cover the treatment and management.
The times that I have been without insurance, it was very hard to acquire because it is very costly. You can get it through prescriptions, but there were not places available like Bethesda.
While receiving treatment, Clark volunteers at the Bethesda Health Clinic, where clinic CEO Dr. John English sees close to 800 diabetic patients walking through the doors.
Diabetes is probably one of the main things that we take care of. Somewhere 15-20% of our patients that come in are diabetic.
With a big focus on affordable treatment, the clinic works to offer options that would help their patients without burning a hole in their wallet, providing free insulin.
It's expensive. The complications come in before they hit any kind of Medicare age. We help them find the lowest glucose monitor so they check their sugars. We're able to get their labs affordably, very, very low cost.
In their attempt to flatten the curve in numbers, English encourages patients to get their screenings early to identify how to keep their symptoms under control.
If we can make any big impact, it's going to be on what we call our pre-diabetics, and then catching people early in the process. If we can get them to lose a little weight, maybe get a little medications on there, we can keep them from getting the more severe episodes of that.
Not to limit your chances of getting diabetes now, English also recommends cutting back on any fast food intake and getting plenty of exercise. Victoria, back to you.
All right, Andrea, thanks so much. All right,